Okay. The cell.
Should we worry about not signing it?
Signing what?
The attendance.
Yeah. I don't think you should worry about it. I just don't know what to do with it, and I'm not so sure I had it. I usually keep it in here. I usually it's in a big folder. But I did do some moving around, so don't worry about it. I'll take responsibility. I'm marking it in the computer, firstly. So the four designated phases of the cell cycle are the G phase, the M phase, the G2 phase. It is the S phase, S equals synthesis, during which the DNA is synthesized in the cell nucleus. The bilayer structure accounts for one of the essential functions of the plasma membrane. It is impermeable to most water-soluble molecules. These are molecules that dissolve in water because the water-soluble molecules are insoluble in the oleophore region. The bilayer serves as a barrier to the diffusion of water and hydrophilic substances while allowing lipid-soluble molecules such as oxygen and carbon dioxide to diffuse through it readily. The eukaryotic cells, EUKARYOTIC, in these cells, the secretion of micromolecules almost always occur in exocytosis. The cellular uptake of nutrients such as cholesterol depends on receptor-mediated endocytosis. Nutrients are not transported via other options. During telophase, the final stage of the new nuclear membrane is formed around each group of 46 chromosomes. The spindle fibers disappear and the chromosomes begin to unfold. Cytokinesis causes the cytoplasm to divide into roughly equal parts during this phase. At the end of telophase, two identical diploid cells called daughter cells have been formed from the original cell. Heat exhaustion occurs when sufficient salt and water loss results in hemoconcentration. If abnormal direct damage occurs to membranes or ATP is depleted, then calcium increases in the cytosol. Liquefactive necrosis commonly results from ischemic injury to neurons and glial cells in the brain. Caseous necrosis, which commonly results from tuberculosis pulmonary infection, particularly Mycobacterium tuberculosis, is a combination of coagulative and liquefactive necrosis. And a reduction in ATP levels causes the plasma membrane sodium-potassium pump and sodium-calcium exchange to cell, which leads to an intracellular accumulation of sodium and calcium and diffusion of potassium out of the cell. When circulating blood volume or blood pressure is reduced, renin, an enzyme secreted by the juxtaglomerular cells of the kidney, is released in response to sympathetic nerve stimulation and decreased perfusion of the renal vasculature. Transcription is the process by which RNA is synthesized from a DNA template. Coronal villus samplin consists of extracting a small amount of villus tissue directly from the coron. This procedure can be performed at 10 weeks gestation and does not require in vitro culturing of cells. Sufficient numbers are directly available in the extracted tissue. Thus, this procedure allows prenatal diagnosis at approximately 3 months gestation rather than at nearly 5 months gestation. Consanguinity refers to the mating of two related individuals, and the offspring of such matings are said to be inbred. Skipped generations are often observed in X-linked recessive disease pedigree because the gene can be transmitted through female carriers. Males are homozygous for genes on the X chromosome. Fathers cannot pass X-linked genes to their sons. X-linked recessive diseases are observed significantly more often in males than in females because males need only one copy of the gene to express the disease. A reduction in the number of functional LDL receptors on the cell surface causes FH. Lacking the normal number of LDL receptors, cellular cholesterol uptake is reduced and circulating cholesterol level increases. An autosomal dominant form of breast cancer accounts for approximately 5% of breast cancers in the United States. Clinical trials using recombinant leptin have demonstrated moderate weight loss as a subset of obese individuals. In addition, leptin participates in important interactions with other components of the appetite control, such as neuropeptide Y, an alpha melanocyte stimulating hormone, and its receptor, the melanocortin-4 receptor. A strong association between type 1 diabetes and the presence of several human leukocyte antigen HLA class II alleles indicate that type 1 diabetes is an autoimmune disease. Prader-Willi syndrome can be caused by a 4MB deletion of chromosome 15q when inherited from the father. Activation of the classical pathway begins only with the activation of protein C1 and is preceded by the formation of a complex between an antigen and an antibody to form an antigen-antibody complex or immune complex. C3b, a component of the complement cascade, adheres to the surface of a pathogenic microorganism and serves as an efficient opsin. Opsins are molecules that tag microorganisms for destruction by cells of the inflammatory system, primarily neutrophils and macrophages. In some cases, impaired healing is not directly associated with aging in general, but can instead be linked to a chronic illness such as cardiovascular disease or diabetes mellitus. The only three primary systemic changes associated with acute inflammatory response are fever, leukocytosis, transient increase in circulating leukocytes, and increased levels in circulating plasma proteins. IgA can be divided into two subclasses, IgA1 and IgA2. IgA1 molecules are predominantly found in the blood, whereas IgA2 is a prominent class of antibody found in normal body secretions. Clonal selection, a process during which antigens select those lymphocytes with compatible receptors, expands their population and causes differentiation into antibody-secreting plasma cells or mature T cells. Many viruses like measles and herpes are inaccessible to antibodies after the initial infection only because these viruses do not circulate in the bloodstream, rather they remain inside of the infected cells, spreading by direct cell-to-cell contact. B cell function is altered with age, as shown by decreases in specific antibody production in response to antigenic challenge, with concomitant increases in circulating immune complexes and in circulating antibodies against self-antigen. Aging does not play a role in either decreasing T cell circulation or increasing helper T cell production. Typically, IgM is produced first, the primary immune response, followed by IgG, against the same antigen. Only Th1 cells help develop cellular immunity. Histidine bound to H2 results in the degranulation of mast cells during an IgE-mediated hypersensitivity reaction. The mechanism that results in type 2 hypersensitivity reaction begins with antibody binding to tissue-specific antigens or antigens that have attached to particular cells. The cell can be destroyed by antibody IgG or IgM and activation of the complement cascade through the classical pathway. Erythrocytes are destroyed by complement-mediated lysis in individuals with autoimmune hemolytic anemia or as a result of autoimmune reaction to ABO mismatched transfused blood. The mechanism that results in type 2 hypersensitivity reaction involves a subpopulation of the cytotoxic cells that are not antigen specific, like natural killer cells, NK. An antibody on the target cell is recognized by the Fc receptors on the NK cells, which releases toxic substances that destroy the target cell. The recipients, like lymphocytes, interacting with the donor's dendritic cells within the transplanted tissue usually initiate sensitization, resulting in an induction of recipient Th1 and Tc cells against the donor's antigens. Then the Th1 cells release cytokines that activate infiltrating macrophages, and Tc cells directly attack the endothelial cells in the transplanted tissue. The characteristics of serum sickness are observed in only systemic type 3 autoimmune diseases such as Raynaud phenomenon. From the perspective of microorganisms that cause disease, the infectious process undergoes 4 separate stages of progression: colonization, invasion, multiplication, and spread. The host's defense against fungal infection includes fungostatic properties of neutrophils and macrophages. T lymphocytes are crucial in limiting the extent of infection and producing cytokines to further activate the macrophages. One particular family of viruses, retroviruses, such as HIV, carries an enzyme, reverse transcriptase, which creates a double-stranded DNA version of the virus. The major immunologic finding in AIDS is the striking disease and the decrease in the number of CD4 cells, Th cells. The sympathetic nervous system is aroused during the stress response and causes the medulla of the adrenal gland to release catecholamines, 80% epinephrine, 20% norepinephrine into the bloodstream. During stress, norepinephrine raises blood pressure by constricting peripheral vessels. It dilates the pupils of the eye, causes piloerection, and increases red gland action in the armpits and palms. Androgens suppress T and BC responses. Estrogen directly stimulates the CRH gene promoter and the central non-adrenergic norepinephrine system, which may help explain adult women's slight hypercortisolism, increases in affective anxiety and eating disorders, mood cycles, and vulnerability to autoimmune and inflammatory diseases. Fight or flight behaviors are characteristic of the more advanced adaptive stage, whereas remaining options are noted in the initial alarm stage. Carcinoma in situ, CIS, refers to pre-invasive epithelial lymph tumors of the glandular or squamous cell origin. These early stage cancers are localized to the epithelium and have not broken through the local basement membrane or invaded the surrounding tissue. Anaplasia is defined as the loss of cellular differentiation, irregularities of the size and shape of the nucleus, and loss of normal tissue structure. In clinical specimens, anaplasia is recognized by a loss of organization and significant increase in nucleosides with evidence of ongoing proliferation. Amplifications are the result of the duplication of a small piece of a chromosome over and over again. Consequently, instead of the 2 normal copies of a gene, tens or even hundreds of copies are present. The NYC oncogene is amplified in 25% of childhood neuroblastoma. Cancer cells, when they reach a critical age, somehow activate telomeres to restore and maintain their telomeres, and thereby make it possible for cells to divide over and over again. Some organs appear to be more susceptible to oncogenic effects of chronic inflammation. For example, the GI tract, the prostate, thyroid gland, pancreas, urinary bladder, fur, and skin. One large study found a 66% increase in the risk of lung cancer among women with chronic asthma. Chemotherapy and radiation may cause increased cell turnover, thereby leading to oral ulcers, stomatitis, malabsorption, and diarrhea. The superior coliaca follicula are involved with voluntary and involuntary visual motor movements, which is the ability of the eyes to track moving objects in the visual field. Visceral pain refers to pain in internal organs and the abdomen and is transmitted by sympathetic apheresis. Visceral pain is poorly localized because of fewer neuroreceptors in the visceral structures. A small group of hypothalamic nerve cells, the suprachiasmatic nucleus (SCN), controls the timing of the sleep-wake cycle and coordinates the cycle with the circadian rhythm in areas of the brain and other tissues. 3 types of parasomas include arousal disorders, such as confusional arousal, sleepwalking, and night terrors. REM sleep accounts for 20-25% of sleep time and is characterized by deep synchronized, low voltage, fast activity that occurs for 5 to 16 minutes, approximately every 90 minutes, beginning after 1 to 2 hours of non-REM sleep. Obstructive sleep apnea is characterized by repetitive increases in resistance to airflow within the upper airway with loud snoring, gasping, intervals of apnea lasting from 10 to 30 seconds, fragmented sleep, and chronic daytime sleepiness and fatigue, as well as decrease in oxygen saturation. I need to tell them to sleep in the other room. Okay. The sleep pattern of the older adult is different from the younger adult in that total sleep time is decreased and the older individual takes longer to initiate and maintain sleep. Older adults tend to go to sleep earlier in the morning and wake up more frequently during the night than earlier in the morning. No, earlier, they sleep earlier in the evening. Rapid eye movement and slow wave sleep decreases. The alteration in sleep pattern typically appears approximately 10 years later in women than it does men. Phantom limb pain is pain that an individual feels in an amputated limb after the stalk has completely healed. It is more likely to appear in individuals who experience pain in the limb before amputation. According to the specific theory, a direct relationship exists between the intensity of pain and extended tissue injury. Apnea is viewed as a criterion of brain stem death. The cerebral posturing includes optotonus, which is hyperextension of the vertebral column, with clenching of the teeth, extension, abduction, and hyperformation of the arm, and extension of the lower extremities, including planar extension. Anomia is the ignorance or denial of the existence of the disease. The oculomotor cranial nerve 3 is involved in this manifestation of pupil dilatation. Parkinson's disease is a commonly occurring degenerative disorder of the basal ganglia and not of any other brain structures. MS, multiple sclerosis, is an autoimmune disorder diffusely involving the degeneration of central nervous system myelin and the loss of axons. Exertional fatigue and weakness that worsens with activity, includes rest and reoccurs with resumption of activity, characterizes myasthenia gravis. All available antidepressants share a common property, albeit through different mechanisms that increase monoamine transmitter levels within the synapse, which is the basis for the antidepressant effects. GAD is general anxiety disorder. It's diagnosed when an individual spends at least 6 months worrying excessively and exhibits at least three of 6 symptoms. Emphalocele refers to a herniation or protrusion of the brain and meninges through defect in the skull, resulting in its sac-like structure. Calcium is considered an important second messenger that facilitates the binding of a hormone, like norepinephrine or angiotensin to a surface receptor, activating the enzyme phospholipase C through a G protein inside the plasma membrane. TSH, which is sensitized and stored in the anterior pituitary, stimulates the secretion of thyroid hormone by activating intercellular processes, including the uptake of iodine necessary for the synthesis of thyroid hormone. Hypoglycemia followed by rebound hyperglycemia is observed only in the symptomology effect. In the female fetus, the anterior pituitary secretes high levels of two gonadotropins, stimulating hormone and luteinizing hormone. Having ejected a mature ovum, the resulting structure is a corpus luteum. Extra hypothalamic factors cause the hypothalamus to secrete GnRH, which stimulates the growth hormone, which stimulates the anterior pituitary to secrete gonadotropins, follicle-stimulating and luteinizing hormones. These hormones in turn stimulate the gonads, ovaries, or testes to secrete female or male sex hormones. Compartment 4 disorders include the central nervous system conditions, in particular hypothalamic disorders. Unpredictable and variable bleeding in terms of amount and duration characterize dysfunctional uterine bleeding, especially during perimenopause. Dysfunctional bleeding also may involve flooding and passage of large clots, which often indicate excessive blood loss. This excessive bleeding can lead to iron deficiency anemia. Gliomas, commonly called myomas or uterine fibroids, or benign smooth muscle tumors in the myometrium. The most common cause of galactorrhea is non-urical hyperprolactinemia or excessive amounts of prolactin. A variety of exogenous agents such as drugs and disorders can trigger one of these 3 mechanisms, thereby causing hyperprolactinemia. Hypothyroidism causes decreased secretion of hypothalamic thyroid releasing hormone, which stimulates the release of prolactin from the pituitary. And the proliferation of lactoferrous breast ducts is not associated with galactorrhea. Because it cannot undergo mitotic division, the erythrocyte has a limited lifespan of approximately 120 days. Only monocytes migrate into a variety of tissues and fully mature into the tissue, macrophages, and myeloid dendrit cells. The spleen is the largest of the secondary lymphoid organ, and it's the site of fetal hematopoiesis. Splenic absence for any cause, atrophy, trauma, removal, cardiac disease, has several secondary effects on the body, among them an increase in morphologically defective blood cells in circulation, confirming the spleen growth and removing old or damaged cells. Transferrin is recycled in the transferrin cycle in the following manner. The transferrin iron complex binds to a transferrin receptor on the erythroblast plasma membrane. The complex moves into the cell by receptor-mediated endocytosis. Iron is released or dissociated from transferrin, and the dissociated transferrin is returned to the bloodstream for reuse. Clinically administered heparin or heparin sulfate on the surface of the endothelial cells binds to AT3 and induces a conformational change that enhances its activity. Under normal conditions, the presence of endothelial cell heparin sulfate and available AT3 in circulation cooperate to protect the vessels from the effects of spontaneous activated thrombin. The fundamental physiological manifestation of anemia is a reduced oxygen carrying capacity of the blood, resulting in tissue hypoxia. Only pernicious anemia is caused by vitamin B12 deficiency, which is often associated with the end-stage type A chronic atrophic gastritis. Deficiency in intrinsic factor secretion may be congenital or may result from adult onset gastric mucosal atrophy and the destruction of parietal cells. In older adults, virtually all vitamin B12 deficiency anemia is caused by failure of the IF-related absorption. Plasma iron levels would be high. Just remember what my plasma iron levels will be high. Okay, this has to do with sideroblastic anemia. What would be the expected effect on plasma iron levels? Eosinophilia is an absolute increase more than 450 units per liter in the total number of circulating eosinophils. Allergic disorders such as type 1 hypersensitivity associated with asthma, hay fever, and drug reactions, as well as parasitic infections, particularly with metazoal parasites, are often cited as causes. Elevated levels of calcium in the blood, hypercalcemia characterize the most common presentation of NM. Multiple myeloma. Endotoxin in particular triggers the release of multiple cytokines that play a significant role in the development and maintenance of DIC. These pro-inflammatory cytokines, TNF-alpha, IL-1, IL-6, IL-8, CAF, are responsible for the clinical signs and symptoms associated with sepsis associated with DIC. D-dimer testing measures a specific DIC-related product. When hemoglobin falls below 5 grams per deciliter, pala, tachycardia, and systolic murmurs may occur. Hyperdilaplody, which is the increased number of chromosome copies, is associated with lymphomatosis. Papillary muscles are extensions of the myocardium that pull the cuffs together and downward at the onset of ventricular contraction, thus preventing the backward expulsion into the atrium. The heart has an extensive capillary network with approximately 3,300 capillaries per milliliter, which is approximately 1 capillary per 1 muscle cell. In the Frank Starling law, the cardiac muscle, like other muscles, increases the strength of contraction when it is stretched. Arterial stiffening occurs with aging, even in the absence of clinical hypertension. Where flow is obstructed, the vessel turns or blood flows over rough surfaces. The flow becomes turbulent with whirls and eddy currents that produce noise, causing a murmur to be heard on auscultation, such as occurs during blood pressure measurement with a sphygmometer. Arteriosclerosis begins with an injury to the endothelial cells that line the arterial walls. Possible causes of endothelial injuries include common risk factors for arteriosclerosis, such as smoking, hypertension, diabetes, increased levels of LDL, decreased levels of high HDL, and autoimmunity. Angiotensin II is responsible for the hypertrophy of the myocardium and much of the renal damage associated with hypertension. Superior vena cava syndrome is a progressive occlusion of the superior vena cava that leads to venous distension in the upper extremities and head. Nicotine stimulates the release of catecholamines, epinephrine, and norepinephrine, which increases the heart rate and causes peripheral vascular constriction. As a result, blood pressure increases, as do both cardiac workload and oxygen demand. Angiotensin II is released during myocardial ischemia and contributes to the pathogenesis of an MI in several ways. First, it results in the systemic effects of peripheral vasoconstriction and fluid retention. These homeostatic responses are counterproductive in that they increase myocardial work and thus exacerbate the effects of loss of myocyte contractility. Angiotensin II is also locally released, where it is a growth factor for vascular smooth muscle cells, myocytes, and cardiac fibroblasts. This promotes catecholamine release and causes coronary artery spasm. Pericardial effusion and left heart failure are the most common complications of human immunodeficiency virus infection. Other conditions include cardiomyopathy, myocarditis, tubercular pericarditis, infective and non-bacterial endocarditis, heart block, pulmonary hypertension, and non-retroviral drug-related cardiac toxicity. Truncus arteriosus is the failure of the large embryonic artery, the truncus arteriosus, to divide into the pulmonary artery and the aorta, which results in a single vessel arising from both ventricles, providing blood flow to the pulmonary and systemic circulations. No lymphatic structures are located within the axinus, ACI in the US. The most important cause of pulmonary artery constriction is low alveolar PaO2. The most common cause of pulmonary edema is heart disease. When the left ventricle fails, filling pressures on the left side of the heart increases and causes a concomitant increase in pulmonary capillary hydrostatic pressure. Absorption atelectasis is the result of gradual absorption of air from obstructed or hypoventilated alveoli or from inhalation of concentrated oxygen or acid agents. Varicose bronchiectasis exists when both constrictions and dilations deform the bronchi. Pleural effusion is the presence of fluid in the pleural space. Atroneuropeptide peptide, AMP, and brain neuropeptide peptide, BNP, inhibit the secretion of renin, inhibit angiotensin-induced secretion of aldosterone, vasodilate the afferent and constrict the efferent glomerular arterioles, and inhibit sodium and water absorption by the kidney tubules. Antidiuretic hormone is required for water to be reabsorbed in the distal tubules and collecting duct. The latter, straight segment of the distal tubule and collecting duct are permeable to water as controlled by antidiuretic hormone. The glomerular filtration rate provides the best estimate of the level of functioning of renal tissue. a urine sodium of over 30 milliliters per liter is indicative of ATM. Bone and skeletal changes develop with alterations of calcium and phosphate metabolism. These changes begin when the cellular filtration rate decreases to 25% or less. The combined effect of hyperparathyroidism and vitamin D deficiency can result in renal osteodystrophies, osteomalacia, osteoitis fibrosa with increased risk of fractures. Other consequences of secondary hyperparathyroidism include soft tissue and vascular calcification, cardiovascular disease, and less commonly, calcific rheumatic encephalopathy. Aniridia, which is the lack of an iris in the eye, is an anomaly often associated with Wilms tumor. Approximately 10% of children who have Wilms tumor also have a loss of other important genes and therefore have a number of congenital anomalies. Only the enterocoffin-like cells secrete histamine. Only stomatostatin inhibits the secretion of acid and pepsinogen and decrease gastric release. Vitamin B12 is not necessary for platelet maturation. Most vitamin B12 or cobalamin is bound to intrinsic factor, making it resistant to digestion, and is absorbed in the terminal ileum, although a small amount of the vitamin is absorbed in its free unbound form. Primary causes of secretory diarrhea are bacterial enterotoxins, particularly those released by cholera or strains of E. coli, neoplasms such as gastroma and thyroid carcinoma. Low concentrations of anaerobes are not the cause of abdominal pain. Intussusception is the telescoping of part of the intestine into another secretion of the intestine, usually causes strangulation of the blood supply. If the obstruction is at the pylorus or high in the intestine, then metabolic alkalosis initially develops as a result of excessive loss of hydrogen ions that normally would be absorbed through gastric juices. Dumping syndrome occurs with varying severity in 5 to 10% of individuals who have undergone partial gastrectomy or pyeloplasty. Rapid gastric emptying and the creation of a high osmotic gradient in the small intestine causes sudden shift of fluid from the vascular compartment to the intestinal lumen. Plasma volume decreases, causing vasomotor responses such as increased pulse rate, hypertension, weakness, pallor, sweating, and dizziness. Rapid distension of the intestine produces a feeling of epigastric fullness, cramping, nausea, vomiting, and diarrhea. The clinical manifestation of pyloric stenosis is an infant who has been well fed and has gained weight begins to vomit without any apparent reason. And this appears between weeks 2 and 3 after birth. And the vomiting gradually becomes more forceful. Okay, in intussusception, a single normal stool may be passed, evacuating the colon distal to the apex of the intussusception. After passing a normal stool, 60% of the infants will pass a current jelly stool, which appear dark and gelatinous, because of their blood and mucus content. Infants have low fluid reserves and relatively rapid peristalsis and metabolism. Therefore, the danger of dehydration is great. Physiologic jaundice in a newborn is caused by mild, unconjugated, indirect reacting hypobilirubinemia. A synchondrosis is the only type of joint in which haline cartilage, rather than fiber cartilage, connects to two bones. The joints between the ribs and the sternum are synchondrosis. Aging does not typically have an effect on the Harrison system as to do with adults. Rankl, which is at RANKL, activates the receptor RANK, which is expressed on the osteoclast and nephrocortex and suppresses apoptosis, which leads to activation and prolongation of the osteoclast survival. Bone loss in women is associated with menopause. Bone loss is most rapid in the first year after menopause, but persists throughout the postmenopausal years. The onset of JRA is less gradual than is adult RA. JRA also differs from the adult form in that predominantly the large joints are affected in JRA. Osteosarcoma is the most common bone tumor that occurs during childhood. Okay, until adult stature is reached, growth in the length of bone occurs at the physeal plate through the endochondral ossification. Cartilage cells at the epithelial side of the physeal plate multiply and enlarge. As rapidly as new cartilage cells form, cartilage cells at the metaphyseal side of the plate are destroyed and replaced by bone. And bone growth is not hormonally controlled. Spread of infection to a contiguous joint is related to the child's age. Metaphyseal infection may be spread to a continuous joint if the fibrous joint capsule includes the metaphysis and epiphysis. This special situation exists at the hip joint, distal femur, proximal femurs in the radius, and the lateral ankle. Cutaneous vasculitis involves a deposit of immune complexes initiating an uncontrolled inflammatory response and causing lesions that are often polymorphic. Okay, when you're dealing with frostbite, immersion in a warm bath, 40 to 42 degrees Celsius, 104 and 107.6 degrees Fahrenheit, until the frozen tissue is thawed is the best treatment for frostbite. Rubbing or massaging the area would damage the traumatized cells. Itching is considered a hallmark of atopic dermatitis, and rubbing and scratching that to relieve the itch are responsible for many of the clinical changes of atopic dermatitis. Bullous impetigo is a rare variant of impetigo caused by Staph aureus. The staphylococci produce a bacterial toxin called exfoliative toxin, ET, which causes a disruption in the desmosomal adhesion molecules with blister formation characteristic of bullous impetigo. The primary lesion of the body louse, or folliculosis, exhibits a pinpoint red macule, papule, or willow with a hemorrhagic puncture site. Scabies is the only contagious disease caused by the itch mark. Scabia. A port wine stain is the only option that is present at birth or within a few days after birth and does not fade with age. Normal endothelial cells have little interaction with lymphocytes except when stimulated by TNF, IL-1, and IL-6. This selection, the most reliable criterion for adequate resuscitation of burn shock is urine output. The normal respiratory rate range for infants is 30 to 53 breaths per minute. Okay, guys, that's it.